So I had a my eye procedure in my very own office. In fact, right here, soon after I had a procedure by Dr. Mauricio Herrera, my orthopedic surgeon, who found at the time of a meniscal debridement that I had medial femoral condyle defect. At that point, I had drilling of the defect with the hope that we would get fibrocartilage formation. But we knew that MRI follow-up would not really demonstrate the extent of fibrocartilage formation, so we decided to do a my eye procedure in order to directly look at the articular surface and see if there was any cartilage growth.
Hi, I'm Dr. Mauricio Herrera. I'm an orthopedic surgeon specializing in sports medicine and arthroscopic surgery. So I've had the opportunity to use the my eye. You don't have to put the patient under general anesthesia at all. They're wide awake. You can numb the area and just place the needle inside the joint. And in real time, you can actually get the diagnosis. A lot of times we have to send patients for MRI, and that could take weeks before we get authorization. With the my eye, if someone comes in to the office with knee pain or after an injury, immediately that same day we can put the camera in and take a look for ourselves and make the diagnosis at that point. Patients find that very interesting.
Yeah, I just feel pressure, but it's not pain.
It's not painful, okay.
The lidocaine work really well.
Yeah. So the idea here with the my eye is that Dr. Herrera is assessing whether the articular cartilage has grown in. I've been on crutches for 4 weeks, not weight bearing. And in the first surgery, he did an assessment. You could see the defect on the femoral condyle, and then he did the formal arthroscopy. We're hoping that the microfracture procedure worked and that cartilage grew in.
Following the my eye scope, Dr. Badia and Dr. Herrera discovered he did not develop the fibrocartilage they had hoped for, and they proceeded with a high tibial osteotomy, which finally gave Dr. Badia pain relief after suffering years with osteoarthritis.
So I'm choosing to use a my eye in my own practice because it allows me to see the joint directly as opposed to simply a representation, which is what we see in MRI or ultrasound or certainly plain x-ray. My eye was really painless during the procedure and even afterwards. In fact, the night that I had my knee scoped, I worked out. I think I did Peloton the following day, as Dr. Herrera does as well. He coached me to use Peloton, and frankly, I coached him to use my eye because I found in my practice I was able to use a scope in the shoulder. I'm an upper limb specialist, and I was able to really see the rotator cuff, see the labrum, because an MRI doesn't always give you the whole picture. And my eye is really an arthroscopy, which allows us to do a much more succinct and specific diagnosis.